Hello everyone. In this video I am going to explain about a Rinnie test. As we all know, Rinnie test is a tuning fork test. So first let's see what is tuning fork. The tuning fork is a device usually made of steel, magnesium or aluminium that is used to tune musical instruments or by singers to obtain certain pitches. A tuning fork emits a tone at a particular pitch and has a clear musical quality. The tuning fork is set into vibration by holding the stem in the hand and striking one of the times against a firm but resilient surface. Tuning fork with frequencies less than 512 Hz may be felt, making it difficult to use for assessing auditory sensation. This image shows the history of the tuning fork. Now let us look into the Rinnie test in detail. The author of the Rinnie test is Heinrich Adolf Rinnie. In 1855 he found it. The principle of the Rinnie test is comparison between air conduction and bone conduction. The placement of the Rinnie test is for AC 2 to 3 cm away from the pinna and for BC on the mastoid process. The instructions are: the clinician instructs the patient to sit in a comfortable posture, then will place the vibrating tuning fork in front of the ear and behind the ear. Then will ask the patient to inform us whether you hear more sound in AC or in BC. The procedures are: strike the tuning fork and place it parallel to the external auditory meters for few seconds. Then shift the tuning fork to the mastoid process of the patient. Patient will be asked to compare the perception of the tone between two placements. There is another method also known as modified Rinnie test. Modified Rinnie test means alternatively patient is asked to compare the loudness of sounds between AC and BC. In interpretation we will get two types: Rinnie positive or Rinnie negative. In Rinnie positive, AC will be greater than BC, which indicates normal, otherwise sensorineural hearing loss. In Rinnie negative, we will get conductive hearing loss because BC is greater than AC. In Rinnie positive, if patient says perception of sound through AC is more louder than BC, which indicates normal hearing or sensorineural hearing loss. In Rinnie negative, if patient says perception of sound through BC is predicting the ABG gap. In Rinnie negative for 256 Hz and Rinnie positive for 512 Hz and 1024 Hz, indicating ABG gap of 20 to 30 dB. Rinnie negative for 256 Hz and 512 Hz, Rinnie positive for 1024 Hz, indicating ABG gap of 30 to 40 dB. Rinnie negative for 256 Hz, 512 Hz, 1024 Hz, indicating ABG gap of 45 to 60 dB. Now let's look into false negative Rinnie results. A patient with a severe to profound sensorineural hearing loss in one ear, means unilateral sensorineural hearing loss, may give a false negative Rinnie results due to the better ear cochlea's response because of transcranial transmission of sound. False positive Rinnie results occurs normal hearing or minimal degree of hearing loss in PT average with a 15 to 20 dB ABG gap at 250 Hz and 500 Hz, may be due to conductive pathology, misses out in Rinnie test. This is indicative of false positive Rinnie results. The advantages of Rinnie results are less time consuming, easy to administer, doesn't require any other instrumentation. And the disadvantages are, if patient says AC is equal to BC, then there should be another variation of Rinnie test to be used to find out accurate results. It is done by comparing the duration of perception through AC and BC. Third one, fail to achieve high level of accuracy in conductive versus non-conductive. According to Gelfand, a Rinnie test cannot identify conductive hearing loss unless the airborne gap is at least 25 to 40 dB. Hence, there are chances to miss out finding mild conductive hearing loss. And tuning fork test cannot identify the severity of hearing loss. In this video, we are going to explain about how we will perform Rinnie test. First, we will instruct the patient. Sit straight, and I will be placing this tuning fork in front of your ear and at the back of your ear. Just inform me in which side, front or back, you are hearing the sound more louder. Okay? Okay. In which side you heard the sound more loudly?
Front side.
Front side. She heard the sound more loudly in front side, which indicates she is having normal hearing sensitivity.